The sign language interpreter showed up for her weekly shift at the community health clinic and noticed something odd. The same deaf patient had been coming in every Tuesday for 6 months, always scheduled with the same doctor for 15-minute appointments, but the medical records showed no actual treatment or prescriptions being issued, just brief checkups that led nowhere. The interpreter, a woman named Karen in her 40s, couldn't ask the patient directly because that would violate her professional neutrality. But during the next appointment, she paid closer attention and realized the doctor was barely examining the patient, just going through motions and dismissing her quickly. The patient kept trying to explain symptoms through Karen, but the doctor would cut her off and say everything looked fine. After the appointment, Karen did something interpreters aren't supposed to do. She stayed late and reviewed the patient's file with permission from the office manager who she'd known for years. What she found was that the patient had been complaining about the same abdominal pain for 6 months, and the doctor had noted it every time, but never ordered any tests or imaging, just kept scheduling follow-ups. Karen went home that night and couldn't sleep. The next morning she called a deaf advocacy organization and explained the situation without using names. They told her this was a known problem, that some doctors dismiss deaf patients because communication takes longer and they assume the patients are exaggerating or don't understand their own bodies. The advocacy group connected Karen with a different doctor at a hospital across town who specialized in working with deaf patients. Karen reached out to the patient through the clinic's messaging system and told her about the other doctor, said it wasn't her place to interfere, but she thought a second opinion might help. The patient went to the new doctor, who immediately ordered an ultrasound. They found a massive ovarian cyst that had been growing for months and was close to rupturing. The patient had emergency surgery 3 days later and recovered fully. She came back to thank Karen a month after the surgery and told her through interpretation that she thought the pain was normal because the first doctor kept saying nothing was wrong, had started to believe maybe she was imagining it. Karen filed a formal complaint against the original doctor with the state medical board. The investigation found he had been dismissive of multiple deaf patients over the years, and he lost his license to practice. The health clinic implemented a new policy requiring all doctors to complete disability sensitivity training and allowing interpreters to flag concerns about patient care without violating neutrality. Karen still works at the same clinic, but now she is also training other interpreters on how to advocate for patients when they see patterns of neglect. She keeps a photo on her desk of the patient at her 1-year follow-up, healthy and smiling, because she learned that interpretation isn't just about translating words. It's about making sure someone's pain gets heard, even when others refuse to listen. Comment interpreted if advocacy saves lives.